I'm Mrs. Princey, Associate Professor in Mental Health Nurse. When you do the psychiatric assessment, it's very important to find out whether the patient is having associated neurological problem. So you're going to find out whether the patient is having any kind of a disorder or diseases related to the nervous system. So how should we do it? So we have got an assessment called as a neurological assessment or the neurological examination. So today you're going to learn about the neurological examination. As a part of the total physical assessment, nurses are involved in the assessment of the neurological system, that is the neurological examination as well as the physical examination. Right. So let us see what are those aspects of the neurological examination. The first thing is the level of consciousness. So you're going to find out what is the level of the consciousness. Second thing you're going to do is the mental status examination. The third thing is the assessment of the cranial nerve function. So third one is about the special cerebellar function. You're going to do the assessment of the cerebellum, right? The next thing you're going to do is the sensory function assessment, the motor function assessment, the cerebellar function assessment, and the reflexes. So these are the aspects that you're going to do in the neurological examination. When you do a neurological examination, we require certain equipments for doing the examination. So what are those equipments which are required when we are doing a neurological examination? The one thing is you need a tray with a cover, then you need a sheet to cover the patient, you need a pair of gloves, a reflex hammer that you may require to do the reflexes assessment. You may require the tuning forks to do the assessment of the function of the hearing ability. Right, then you require the Snellen's chart to do the visual acuity, pen light or otoscope, cotton swab, as well as the bow. The other things that we require for the examination is the BP apparatus to monitor the BP, the stethoscope to find out the heart rate and the respiratory rate to find out the abnormalities in the heart. Then you require a kidney tray to discard all the waste objects. All right. Test tubes, you may require two test tubes, one which is filled with the hot water, the other thing which is filled with the cold water. And you may require a torch as well as a pin or the needle. So these are the equipments which is required for doing a neurological examination. So what is the indication of doing the neurological examination? Yes, you are supposed to do the neurological examination in all the patients, but you may not require to do a in-detail neurological examination. There are conditions or diseases wherein you may have to give an importance to neurological conditions, right? What are those indications of doing the neurological examination? Some disorders which are related to the CNS system like meningitis, head injury, brain tumor, unconscious patient, high-grade fever, tetanus, and the patient who is in the coma. So these are the indications for doing a neurological examination where you may have to do the in-detail assessment of the nervous system. Right. So let us see each of the aspects in detail. The first thing that you're going to check is the level of the consciousness. So in the level of consciousness, we have got the various categories, like you're going to assess whether the patient is alert, you're going to assess the patient is lethargic, stuporous, you're going to assess the patient is semi-comatose or is in the state of coma. So now let us see what is the meaning of being alert. Okay, how can we say the patient is alert? So we can say the patient is alert when he is awake and he responds appropriately to the verbal commands and to all the stimuli in his environment. So he is able to understand what is happening around his surroundings, and he is aware and he gives the response to the various environmental stimulus. We can say that he is alert. The second thing you're going to find out if the patient is lethargic. So how do you know the patient is lethargic? Maybe he is very drowsy. Initially, when you go and talk to the patient, he may give you a response, but very easily goes off to sleep. So that is a state we understand a patient is lethargic. So in case of a psychiatric patient, many of the patients are on the drugs, right? The sedatives it can be. So most of them may look lethargic or they may look drowsy. So you may have to rule out whether it is really the problem related to the neurological system or is the effect of certain medications which is making the patient look lethargic. So you're going to find out whether the patient is drowsy or it goes off to sleep after responding to you initially. Right, that's called as the lethargy. The third thing you're going to find out is whether the patient is in the state of stupor. So we can say the patient is in stupor, wherein it's very difficult to arouse the patient and he will not respond to the environmental stimuli. Very minimal, responses that he may give to the environmental stimuli. Very difficult to arouse such kind of the patient. So we can say that he is in a state of stupor. The next one is being semi-comatose. So what is being semi-comatose? So here the patient will not respond to the verbal stimuli. The patient, you may talk so many things, try to awake the patient, but the patient will not respond to the verbal stimuli, but he will respond to the painful stimuli. Whenever you try to prick him or pinch him, he may try to respond to you, but also you can see some minimal motor movement. So that is the condition we understand the patient is in a state of semi-comatose. So moving on to the state of coma. So here the patient will not even respond to the painful stimuli, right? So even the verbal stimuli, he will not respond. The painful stimuli, he will not respond. There is no physical or the motor movements in the patient. So we can say that the patient is in the stage of the coma. So you may have to do the assessment for such kind of a patients. You may require to maintain a Glasgow Coma scale, a GCS scale, wherein you want to find out based on the responses of eye opening, the verbal stimuli, as well as the motor movements that you're going to do the assessment on a score of 15. Right. So this is the thing that you're going to do when a patient is in the state of coma. So this is about the first aspect of the neurological examination, whereas you're going to assess the level of the consciousness, whether it is alert, whether it is lethargic, or is stupor, or is in a state of semi-comatose, or the coma state. Right. So the next aspect that you're going to check in the neurological examination is the mental status examination. As you can view the video on the mental status examination where I have explained in detail about it. So we have got to do the various assessment in the mental status examination where you're going to examine the general appearance and behavior of the patient. You're going to do the speech assessment, the thought assessment, the assessment of the perception. You're going to assess the cognitive ability of the patient by doing various tests, and also by and also the inside of the patient that you're going to do. So this is the mental status examination in detail that you're going to do in the second aspect of the neurological examination. The third thing that you're going to do in the neurological examination is a special cerebral function. So in the special cerebral function, so in this you're going to assess if the patient is having any conditions like agnosia, apraxia, or the aphasia. Now, what is agnosia? Agnosia is a condition wherein the patient will not be able to recognize the common objects. Okay, so even if you go and place a common object to him, he will not be able to realize or respond or give any kind of reaction or identify what is the object through the senses. So that condition is called as the agnosia. Now, what is apraxia? Apraxia is a condition wherein the patient will not be able to carry out the routine activities or the daily activities even in the absence of the paralysis. So patient is completely all right, physically fit, he's not having any kind of paralysis, but still the patient isn't able to carry out his daily activities, right? So that is called as the apraxia. The third thing you're going to assess if the patient is having aphasia. Aphasia is inability to communicate. So there is a problem with the language, inability to communicate through words or through the phrases. That condition is called as the aphasia. So this is what you're going to do in the special cerebral function, wherein you're going to find out whether the patient is having agnosia, apraxia, or the aphasia. The fourth thing that you're going to do in the neurological examination is about the cranial nerve assessment. Okay, the examination of the cranial nerve. So why cranial nerve assessment is done? You're going to find out if the patient is having any problems which are related to the nerve pathway. Okay, so the pathways related to the various nerves are responsible for various sensory or the motor functions. So you're going to find out over the pathway of these nerves. Is there any problem with the brain stem? Okay, so that is what you're going to find out by doing this assessment of the cranial nerve. So, we have got the 12 cranial nerves. We have got the first one, which is the olfactory nerve. Second cranial nerve is the optic nerve. The third one is the oculomotor nerve. The fourth one is the trochlear. Fifth is the trigeminal nerve. The sixth cranial nerve is the abducens. The seventh cranial nerve is the facial nerve. The eighth cranial nerve is the vestibular cochlear nerve or acoustic nerve. The ninth cranial nerve, we have got the glossopharyngeal nerve. The 10th one, which is the vagus nerve. The 11th one is the spinal accessory nerve. And the 12th nerve is the hypoglossal nerve. So each of these nerves has got its own function related to the motor function as well as the sensory function. Some nerves have got both of these functions of motor and sensory. So let us do the assessment of the cranial nerves. So the first cranial nerve, we have the olfactory nerve. So olfactory nerve is having purely the sensory function. So we have got the senses of smell. When you do the assessment of the olfactory nerve, you may have to ask the patient to close their eye, and you can give two objects which are having some aromas. So for example, you can give a coffee powder and a cinnamon powder. So you ask them to identify what is the object or the item that you have given him to smell. If the patient is able to identify by, when you do this examination, you may have to do the examination by closing the each nostril at a time. So if the patient is able to differentiate the different kinds of the smell, then we can say that the olfactory nerve function is intact. If you give some substances which has got a salt in it, right? The salty substances that you can when you give for the examination can also irritate the nasal mucosa. That thing that you have to keep in mind. If the patient is not able to identify the smell, we can identify or we can rule out the patient is having some condition called as a closed head injury. This is a thing that you can identify by doing the assessment of the olfactory nerve. The second cranial nerve, which is the optic nerve. So here you're going to find out the optic nerve is functioning intact or not. So here you're going to do the assessment of visual acuity. So how will you do the assessment of visual acuity? Through the use of the Snell's chart. So you have to have a distance of 20 feet from the Snell's chart, and you ask the patient to read out from the letters or the alphabets. If the patient is able to do it, then the patient is having a good visual acuity. Otherwise, or he may have some errors in the vision. So that is the first thing you will be doing, the visual acuity test. The second assessment that you're going to do for the optic nerve is the visual field. So you're going to do the visual field assessment, right? The third thing that you're going to do is the assessment of the pupils. So you're going to find out in terms of paralla, where pupils are equal, round, reactive to light and accommodation. So when you pass a pen torch towards the pupil, it has to constrict, and when you move the pen torch away, the pupil has to dilate. So you're going to check the pupillary reflection reaction to the light source. The next assessment, you're going to do the assessment of the optic nerve. You're going to find out if there is any kind of blood stains or hemorrhages in the nerve. So in case of diabetic retinopathy, you're going to find out if the patient is having some problems in the optic nerve by doing the fundoscopic examination. You're going to observe the nerves. The next cranial nerve assessment that you're going to do is the oculomotor nerve. Right? So as the name says, oculomotor, you're going to check the movements of the eyeball, whether the patient is able to move the eyeballs in all the 6 directions, except the outward and down in position. Okay, where if the patient is not able to move the eyes to all the 6 directions except the outward direction and down in inward direction, then the patient is having a problem in the oculomotor nerve. You're going to also assess if the patient is able to open the eyelids, and also you're going to check the pupillary constriction. So this is what you're going to do in the assessment of the third cranial nerve, which is the oculomotor nerve. The next cranial nerve you're going to do the assessment is the trochlear nerve. Trochlear nerve assessment, you're going to find out whether the patient is able to move the eye in the downward and inward direction. So the next cranial nerve, we have got the sixth cranial nerve, which is the abducent nerve. So abducent nerve again is having the function to find out whether the movement of the eyeball can happen in an outward direction. Right. So we have got all three nerves, which is the cranial nerve 3, oculomotor nerve, cranial nerve 4, the trochlear nerve, and cranial nerve 6, which is the abducent nerve. These three nerves are involved to find out the extraocular movement of the eyeball in all the six directions. So if the patient is not able to do the extraocular movement in all the six directions, we can identify the patient is having either a problem in the oculomotor nerve or a trochlear nerve or the abducent. The next cranial nerve is the fifth cranial nerve, which is the trigeminal nerve. Why the name is given as trigeminal? Because it has got the three branches wherein you have to do the assessment in terms of sensation to the face, sensation to the cornea, and sensation to the scalp. And also you will be doing the assessment of the jaw movement. So this is what is the function of the fifth cranial nerve, which is the trigeminal nerve. Now, how do we have to do the assessment? So how we have to do the assessment? We may require a sharp object to do the assessment. You ask the patient to close the eyes so that he will not get any kind of visual cues. Then the first thing that you're going to do is the forehead. Okay, so here you're going to just prick the patient's forehead, the right as well as the left part of the forehead with the sharp object, and ask the patient whether he is able to feel the sensation. This assessment you are going to find out whether the ophthalmic function is intact or not. To do the maxillary branch assessment, again you're going to take a sharp object and touch the object onto the cheeks, separately to the left as well as the right side of the cheek. So if the patient is able to identify or make out the sensation, then we can say the maxillary branch is intact. The third branch that you're going to assess is the mandibular branch. So here you're going to take again the sharp object and you're going to touch the sides of the jaw. Right? So if the patient is able to identify and make out the sensation, then we can say the mandibular branch is intact. So this is why we do the assessment of the trigeminal nerve in terms of the ophthalmic branch, the mandibular branch as well as the maxillary branch. The next cranial nerve assessment is the seventh cranial nerve, which is the facial nerve. So here in the facial nerve assessment, you're going to find out whether the patient is able to do the movements, right? In terms of the expression, in terms of the movements of the face, you're going to find out whether the patient is able to move by asking him to make out different expressions, like asking him to frown, raising the eyebrows. Okay, so that kind of a thing that you will ask him to do the assessment. If the patient is able to do it, it's fine. Otherwise, you're going to rule out if the patient is having any paralysis of the facial muscles in terms of the Bell's palsy. When you do the facial nerve assessment, also you're going to do the assessment of the taste, right? Whether the patient is able to find out the sensation of the taste. The next cranial nerve assessment is the eighth cranial nerve, which is the vestibulocochlear nerve or the acoustic nerve. So here you're going to find out the ability of the patient to hear the sounds. So you're having a test called as the hearing test, wherein you will be using a tuning fork for the assessment. So you have got the Rennie's test as well as the Weber's test. You're going to find out the air conduction as well as the bone conduction to find out the hearing loss or sensory neural hearing loss or the conductive hearing loss. We're going to do the assessment of hearing and balance, whether the patient is having any kind of hearing loss, if the patient is having the vertigo in terms of the balance, right? So this is what you're going to do in the assessment of the eighth cranial nerve, which is the vestibulocochlear nerve. The next cranial nerve is the cranial nerve 9 and cranial nerve 10. So cranial nerve 9, we have the glossopharyngeal nerve, and cranial nerve 10, we have got the vagus nerve. So here you're going to do the assessment of the swallowing reflex, the gag reflex, by asking the patient to open the mouth and saying ah. So you can see the uvula, the movement of the uvula. Right. So the next thing you're going to do the assessment of the vagus nerve. You're going to whether the patient is able to have a good voice quality, that is in terms of the speech. So that is the assessment of the cranial nerve 9 and cranial nerve 10. Coming to the 11th cranial nerve, which is the spinal accessory nerve. So you're going to find out the assessment of the sternocleidomastoid muscle and the trapezius muscle. So for this test, you ask the patient to turn his head towards the side against the resistance. So you can place, as an examiner, you can place your hand beside and you make the patient to move against the resistance of your hand. So both towards the right as well as the left. That is what you're going to assess for the sternocleidomastoid muscle. So coming to the trapezius muscle assessment, you're going to again do a resistance against the shoulder. You will be asking the patient to raise the shoulder against your resistance. If the patient is able to do it, then we can say that the trapezius muscle is intact. So that is the assessment of the spinal accessory nerve. The next and the last cranial nerve is the hypoglossal nerve. So the hypoglossal nerve assessment, you're going to find out the movement of the tongue in all the directions. So a patient is asked to move the tongue inward against the resistance to the cheek, towards the right side, left side, move the tongue up and down. So if the patient is able to move the tongue in all the direction, then we can say that the hypoglossal nerve is intact. This is about the cranial nerve function. So we start from the first cranial nerve, the olfactory nerve, till the hypoglossal nerve. We're going to find out the assessment of the each cranial nerve and identify if there is any problem with the nerve pathway or the basal ganglia. So this is what you're going to do in the cranial nerve assessment, from the first one, which is the olfactory nerve, till the last cranial nerve, which is the hypoglossal nerve, to find out any problems in the pathway or the brain stem.